Welcome everyone. I'm excited to welcome you to today's presentation. Today, we'll be exploring our professional training program for massage therapy. The focus is on providing comprehensive education in techniques, anatomy, and wellness practices for certified specialists. Over the next few slides, I'll guide you through what our program offers and how it can help you advance your skills and career. Let's get started. Let's take a closer look at some key aspects of professional standards and client care. First, ethics are absolutely fundamental. They guide our behavior, ensuring we maintain integrity, respect, and confidentiality with every client. Upholding these standards builds trust and professionalism in our practice. Moving on, we focus on the different massage methods such as Swedish, deep tissue, and sports massage. Each technique has its unique benefits and applications, and understanding them allows us to tailor our approach to meet individual client needs effectively. When it comes to techniques, it's essential to master a variety of skills. This includes understanding how to work with the skeletal and muscular systems. Proper technique not only enhances effectiveness, but also ensures safety for both the client and practitioner. And speaking of anatomy, having a solid grasp of the human body's structure is crucial. Knowing how bones, muscles, and connective tissues interact helps us deliver targeted and beneficial treatments. Overall, these elements, ethics, techniques, and anatomy, are interconnected. They form the foundation of professional, effective client care and help us provide the best possible service while maintaining high standards in our practice. Let's take a moment to appreciate the incredible history and evolution of healing arts, which spans over 5,000 years. Throughout this time, humans have continually sought ways to heal the body and mind, developing a diverse array of practices and philosophies. From ancient civilizations like the Egyptians, Chinese, and Greeks, we've seen how healing was deeply intertwined with spirituality, nature, and community. Over the centuries, these methods evolved, blending scientific discoveries with traditional wisdom. This long history highlights how healing arts are not just about treating symptoms, but also about fostering overall well-being. As we explore this timeline, it's important to see how these ancient practices laid the foundation for modern approaches, connecting the past to our current pursuit of holistic health. Today, I want to highlight how different massage modalities can support both recovery and performance in sports. For example, deep tissue massage is particularly effective for addressing chronic tension that often accumulates in muscles after intense training or competition. It helps break down adhesions and release long-standing muscle tightness, which can improve mobility and reduce the risk of injury. On the other hand, Swedish massage focuses more on relaxation and enhancing circulation. It's great for promoting overall relaxation, reducing stress, and increasing blood flow, which in turn helps the body recover more efficiently. Understanding these modalities allows us to tailor treatments to specific needs, whether it's targeting persistent muscle tension or encouraging relaxation and circulation. This connection between different massage techniques and their benefits plays a vital role in optimizing athletic performance and recovery, fitting perfectly into our overall theme of supporting health and well-being through massage. Let's talk about boundaries and ethics, which are fundamental to creating a safe and effective environment. Setting clear boundaries helps both the therapist and client understand what is appropriate and keeps the relationship professional. Ethics guide us in making responsible decisions, ensuring we act in the best interest of those we serve. Safe techniques are essential. We must always prioritize safety to prevent harm and build trust. When applying techniques, it's important to adapt them to each individual's needs, making sure they're appropriate and effective. This brings us to application, how we actually put these principles into practice during sessions. Custom sessions are key, as they allow us to tailor approaches based on the client's unique goals and circumstances. Proper planning is vital here. It involves preparing thoroughly before each session to maximize its effectiveness. Next, the planning process includes an initial intake and history, where we gather background information to understand the client's situation better. This leads to a comprehensive assessment, helping us identify the most suitable techniques and goals. Finally, I want to emphasize the therapist's responsibilities. It's our duty to maintain professionalism, uphold ethical standards, and prioritize client well-being at all times. By integrating these elements, boundaries, ethics, safety, application, and responsibility, we create a solid foundation for successful and respectful work. Let's talk about some key professional responsibilities that are essential in our practice. First, confidentiality is crucial, always respecting your client's privacy and keeping their information secure. Informed consent is equally important. Make sure clients fully understand what treatment involves and agree to it before proceeding. The scope of practice defines what you're qualified to do, so stay within those boundaries to ensure safe and ethical care. When it comes to conducting the MBLEX exam and meeting state requirements, typically, you'll need between 500 and 1,000 hours of training. This ensures you're well prepared to practice competently. Licensing is another vital step, obtaining the necessary credentials to legally offer massage therapy services. And finally, adhering to professional standards isn't just about following rules. It helps build trust with your clients and maintains the integrity of the profession. Remember, these concepts are interconnected and form the foundation of a responsible and ethical practice. Let's explore how integrating the mind-body connection plays a crucial role in holistic health. When we talk about wellness concepts, we're really emphasizing that health isn't just about the absence of illness, but about achieving a balanced state of physical, mental, and emotional well-being. The mind and body are deeply interconnected, meaning that what happens in one influences the other significantly. For example, stress can impact physical health, leading to issues like headaches or weakened immune function. Conversely, physical activity and relaxation techniques can improve mental clarity and emotional resilience. Recognizing this connection helps us approach health more comprehensively, addressing all aspects of a person rather than isolated symptoms. This holistic approach aligns perfectly with our overall theme, promoting overall wellness by nurturing both mind and body as a unified system. Let's take a closer look at directional terms and body planes, which are essential for professional communication in anatomy. These terms help us describe the location of structures precisely and consistently. For example, when we say anterior, we're referring to the front of the body, while posterior indicates the back. Similarly, superior means above and inferior means below. Understanding these basic terms allows us to communicate clearly, whether we're discussing injuries, medical procedures, or research findings. Now, moving on to body planes, these are imaginary lines that divide the body into sections to help us visualize and describe locations. The main planes are sagittal, coronal, and transverse. The sagittal plane divides the body into left and right halves, while the coronal plane splits it into front and back. The transverse plane cuts horizontally, creating upper and lower parts. By mastering these terms and planes, we establish a common language that improves accuracy and clarity in our professional interactions. This foundation is crucial as we delve deeper into anatomy and its applications, ensuring everyone is on the same page when discussing the human body. Today, I want to highlight the skeletal system, which consists of 206 bones. These bones are essential because they provide the structural framework of our bodies. They support and shape our body, giving us the upright posture we're so familiar with. But beyond just support, bones play a crucial role in joint mechanics, allowing us to move smoothly and efficiently. The way these bones connect at joints enables everything from simple movements like walking to complex actions like jumping or twisting. So, in essence, our bones aren't just static parts. They're active contributors to our movement and stability, tying together the overall theme of how our body functions as a cohesive unit. Let's take a closer look at trigger points, which are tender spots that can develop in muscles and connective tissue. These points can cause pain, discomfort, or even refer pain to other areas. Understanding where these trigger points form and how they affect muscle function is key to managing and preventing injuries. Next, we have fiber types. Our muscles are made up of different muscle fibers, mainly slow-twitch and fast-twitch fibers. Slow-twitch fibers are endurance-oriented, helping us sustain activity over longer periods, while fast-twitch fibers are built for explosive movements and quick bursts of power. Recognizing the balance of these fibers in our muscles can tell us a lot about our athletic strengths and recovery needs. Moving on to muscle layers, which refer to the different levels of muscles within our body. Superficial muscles are close to the surface and often involved in larger, more visible movements, while deeper muscles provide stability and support for more precise actions. Understanding these layers helps us appreciate how complex and integrated our muscular system really is. Finally, the muscular system as a whole is an incredible network that not only facilitates movement, but also plays a vital role in posture, stability, and even circulation. When we understand how trigger points, fiber types, and muscle layers work together, we get a clearer picture of how to optimize performance and prevent injury. All these components are interconnected, forming the foundation of how our body moves and functions efficiently. Today, we're focusing on some of the most vital body systems that keep us alive and well. First, let's talk about the lymphatic system, which plays a crucial role in our immune defense and fluid balance. It helps filter out harmful substances and transports immune cells throughout the body. Next, we have the nervous system, the body's communication network. It controls everything from our thoughts and emotions to muscle movements and reflexes, ensuring that all body parts work together seamlessly. Then, there's the circulatory system, which is responsible for pumping blood, oxygen, and nutrients to every cell. It also removes waste products to keep us healthy. All of these systems, lymphatic, nervous, and circulatory, are interconnected, forming the foundation of our vital body systems. Each one plays a unique but complementary role in maintaining overall health and function. Understanding these systems helps us appreciate how our bodies operate as a complex, integrated whole. Let's take a closer look at some of the systemic effects. First, the tissue response. When the body activates these mechanisms, it actually accelerates healing processes, which is crucial for recovery. Next, the nervous system plays a key role through parasympathetic activation. This helps promote relaxation and recovery, calming the body after stress or exertion. Moving on to circulation, enhanced venous return is another important effect. Better venous return means more efficient blood flow back to the heart, supporting overall cardiovascular health. Putting it all together, these systemic effects highlight how interconnected our body's responses are, working together to promote healing, relaxation, and efficient circulation, all essential components of maintaining overall well-being. Let's talk about client comfort monitoring, which is a crucial aspect of effective therapy. By paying close attention to how the client responds, we can ensure they feel safe and supported throughout the session. One way we do this is through pressure grading on a 1 to 10 scale. This helps us gauge the intensity of our touch, making adjustments as needed to match the client's comfort level. Developing sensitivity is key here. It's about tuning into subtle cues and understanding what the client needs at each moment. All of this forms the foundation of therapeutic interaction. When clients feel comfortable and understood, the effectiveness of our work increases significantly. Touch and pressure are fundamental tools we use, but they must be applied thoughtfully. The goal is to create a connection that is both safe and responsive, fostering trust and openness. So, always remember to monitor comfort levels closely and adapt your touch accordingly. It's essential for building a strong, therapeutic relationship. Let's talk about protecting ourselves as therapists through proper posture and stance. This is a crucial part of body mechanics that often gets overlooked, but can make a big difference in preventing injuries. When we talk about body mechanics, we're really focusing on how we position ourselves during therapy sessions to minimize strain. The key points here are maintaining a stable, balanced stance and using our body efficiently. For example, keeping our feet shoulder-width apart helps provide a solid base of support. Bending at the hips and knees rather than the waist helps reduce stress on our lower back. It's also important to keep the work close to our center of gravity, so bringing the patient or object closer instead of reaching far away. This way, We're using our bigger, stronger muscles rather than relying solely on our back or arms. Overall, good posture and stance are about being mindful of how we position ourselves throughout our workday. Not only does this protect our bodies, but it also allows us to perform our techniques more effectively and sustainably. Remember, incorporating proper body mechanics is a fundamental part of our overall theme, working smarter, not harder, to ensure long-term health and success in our practice. Now, let's take a closer look at some of the key Swedish massage techniques: effleurage, petrissage, tapotement, friction, and vibration. These techniques form the foundation of Swedish massage and are essential for promoting relaxation and improving circulation. Effleurage involves smooth, gliding strokes that help warm up the muscles and set the tone for the session. Petrissage, on the other hand, is a kneading motion that deeply manipulates the muscles, releasing tension and promoting detoxification. Tapotement consists of rhythmic tapping or percussion movements that awaken the muscles and stimulate nerve endings. Friction involves applying deep, circular movements to break down adhesions and increase flexibility. Lastly, vibration uses rapid shaking or trembling motions to relax the muscles further and enhance overall effectiveness. Understanding and mastering these techniques allows us to provide a comprehensive and beneficial massage experience. Let's talk about modesty protocols, which are really important to ensure patient comfort and dignity during treatment. Draping is a key component here. It helps maintain modesty while providing access to the treatment area. When working with special populations, such as pediatric or elderly patients, we need to adapt our approaches to meet their specific needs. Positioning is also crucial. For example, side-lying, face-up, and face-down positions are commonly used, depending on the treatment goals. Face-up positioning, or supine, is often preferred for ease of access and patient comfort, while prone or face-down positioning might be necessary for certain treatments or conditions. Positioning and draping go hand in hand because they work together to ensure the patient's comfort, safety, and modesty throughout the session. Remember, being attentive to these details not only improves the quality of care, but also builds trust with our patients, aligning with the overall goal of providing respectful and effective treatment. Now, let's talk about selecting the right oils, lotions, and therapeutic tools to ensure an optimal glide during your session. The media and tools you choose are crucial because they directly impact both the effectiveness of the massage and the comfort of your client. When selecting oils and lotions, consider their consistency, absorption rate, and scent, as these can influence relaxation and ease of movement. Thicker oils might provide longer-lasting glide, but lighter lotions can be more suitable for sensitive skin or shorter sessions. Therapeutic tools, like massage stones or specialized grips, can enhance your technique and target specific muscle groups more effectively. Remember, the goal is to create a smooth, comfortable experience that promotes relaxation and healing. So always choose your media and tools thoughtfully, aligning them with your overall approach and your client's needs. Today, I want to focus on targeting subsurface layers to effectively release chronic adhesions. When we talk about deep tissue fundamentals, we're really emphasizing the importance of reaching beyond the surface. These adhesions often form in the deeper layers, and if we only address the surface, we might not get the full relief our clients need. So, understanding the structure and function of these deeper tissues is crucial. By focusing on these layers, we're able to break down the scar tissue and restore mobility more effectively. This approach aligns perfectly with our overall goal of promoting better tissue health and function. Remember, patience and precision are key when working at this level, but the results can be truly transformative. Let's talk about cortisol reduction. One effective way to do this is by creating a calming environment. When our surroundings are peaceful and soothing, it helps signal to our nervous system that it's time to relax. Additionally, using rhythmic, slow strokes, whether through massage or gentle touch, can really enhance this calming effect. The focus here is on the nervous system, aiming to promote deep relaxation and help lower stress levels. This approach ties into our overall theme of stress relief, showing how simple, mindful techniques can significantly impact our well-being by reducing cortisol and fostering a sense of calm. tissue repair is a crucial part of recovery, helping our muscles and tissues heal after intense activity or injury. Proper recovery strategies support injury prevention and ensure we're ready for our next training session. Training itself can cause stress on our body, so managing how we recover is key to maintaining performance and avoiding setbacks. Waste flushing is an important concept here. It involves helping the body clear out metabolic waste products that build up during exercise, which can reduce soreness and speed up recovery. Post-event routines are essential for helping the body recover efficiently after a competition or a tough workout. Invigorating prep, on the other hand, prepares your body and mind for upcoming activity, making sure you're energized and focused. Pre-event routines set the stage for optimal performance, helping to warm up muscles and get the blood flowing. And one of the most effective techniques we can use is sports massage. It promotes blood circulation, relaxes muscles, and can significantly improve both recovery and performance. All these elements tie together in a comprehensive approach to athlete health and performance, emphasizing that proper care before, during, and after activity can make a big difference. Let's take a closer look at some of the key techniques used in deactivation. First, referral patterns are crucial to understand because pain or dysfunction in one area can actually originate from another, making accurate diagnosis essential. Next, compression plays a significant role. Applying controlled pressure can help reduce muscle tension and improve blood flow, promoting healing. Trigger point therapy is another powerful method. By targeting specific tight spots within muscles, we can relieve pain and restore function more effectively. These concepts all tie back to the overall theme of addressing underlying causes rather than just symptoms. By combining an understanding of referral patterns with techniques like compression and trigger point therapy, we can create a comprehensive approach that enhances recovery and improves patient outcomes. Now let's talk about client adaptations, specifically for elderly, prenatal, and injured clients. When working with these groups, it's essential to modify techniques to meet their unique needs and ensure safety and comfort. For elderly clients, for example, we often need to reduce the intensity and duration of exercises, focusing on balance, flexibility, and gentle strength building. It's also important to consider any existing health conditions or mobility limitations and adapt accordingly. For prenatal clients, modifications should prioritize safety for both the mother and the baby. This might mean avoiding high-impact activities, lying flat on the back after the first trimester, and emphasizing core stability, breathing, and gentle stretching. When working with injured clients, the goal is to facilitate recovery without causing further harm. This involves tailoring the exercises to their current stage of healing, often starting with very gentle movements and gradually progressing as tolerated. Overall, the key takeaway here is that understanding each client's specific situation allows us to modify techniques effectively, ensuring they get the most benefit while minimizing risk. This personalized approach is vital for achieving successful outcomes and maintaining safety throughout the process. Let's talk about some key points to gather before starting a session. First, understanding the specific pain locations is crucial. Knowing exactly where a patient is feeling discomfort helps tailor the treatment effectively. Next, we want to review their current medications. This gives us insight into any potential interactions or considerations we need to keep in mind. It's also important to look into their medical history and allergies. Being aware of past health issues and allergies ensures we avoid any adverse reactions and provide safe, personalized care. Collecting this essential data up front sets a solid foundation for a successful session. This initial intake and history taking are vital steps in understanding the patient holistically and customizing our approach. Remember, the more comprehensive the information, the better we can serve our patients and achieve optimal outcomes. Now, let's talk about how to identify when massage might be unsafe or when someone needs to get medical clearance before proceeding. This is where understanding contraindications becomes really important. Contraindications are basically conditions or situations where massage could do more harm than good. For example, if a client has a fever, an infectious disease, or open wounds, massage might not be appropriate. Similarly, severe inflammation, blood clots, or certain skin conditions can be contraindications. It's also crucial to pay attention to any recent surgeries or fractures, as massage could interfere with healing. If someone has uncontrolled high blood pressure or heart issues, they should definitely consult their healthcare provider first. The key takeaway here is to always be vigilant and ask the right questions. If you're ever unsure, it's best to err on the side of caution and recommend that the client see a medical professional for clearance. This way, we can ensure that our massage therapy is both safe and effective, aligning with our overall goal of promoting health and well-being safely. Now let's talk about SMART goals. These are specific, measurable, achievable, relevant, and time-bound. They help us set clear and realistic objectives that we can work toward effectively. When assessing pain, we often use the NPRS scale, which rates pain from 0, meaning no pain at all, up to 10, which is the worst pain imaginable. This scale is a simple yet powerful tool to gauge how a patient is feeling and to track progress over time. It's crucial to use this kind of standardized assessment so we can make informed decisions and adjust our treatment plans accordingly. Remember, clear goal setting combined with accurate pain measurement is key to successful patient care and recovery. Now, let's talk about determining the optimal schedule for recovery. One of the key factors here is frequency. It's really about finding the right balance. How often should interventions happen to maximize effectiveness without overwhelming the client? Next, we need to consider tailoring techniques to the specific needs of each client. Every individual is unique, so customizing our approach ensures we're addressing their particular challenges and goals. This leads us to the importance of customization. By personalizing the recovery plan, we create a more engaging and effective process that resonates with the client's individual journey. And of course, all of this ties into treatment planning. A well-thought-out plan that incorporates the right frequency, tailored techniques, and customization is essential for successful recovery outcomes. Remember, the overall goal is to build a schedule that is both effective and sustainable, supporting the client every step of the way. Now, let's talk about some key communication skills that can really make a difference. First, using clear, jargon-free language is essential. It ensures that your message is easily understood without causing confusion. When you speak simply and directly, people are more likely to stay engaged and grasp what you're saying. Next, practicing empathetic responses is crucial. This means showing that you genuinely understand and care about the other person's feelings and perspective. It helps create a safe space for open dialogue. Active listening techniques are also vital. This involves really focusing on what the other person is saying, asking clarifying questions, and giving feedback. It demonstrates that you're attentive and value their input. All of these skills, clarity, empathy, active listening, are fundamental in building rapport and trust. When people feel heard and understood, they're more likely to open up and collaborate effectively. Remember, strong communication skills are at the heart of effective relationships and successful interactions. They help us connect on a deeper level and foster a positive environment for everyone involved. Let's talk about single-use protocols today. These are essential procedures that help us maintain a safe and hygienic environment. First, linens. Using fresh linens for each client or procedure helps prevent cross-contamination. When it comes to table cleaning, thorough cleaning between uses is crucial to remove any residues or germs. Surfaces should always be disinfected properly, and that's where EPA-approved disinfectants come into play. They ensure we're using effective products to kill pathogens. Sanitization is a key step in reducing the spread of germs, and it applies to many areas, including tools and workspaces. Hand washing, especially for at least 20 seconds, remains one of the most effective ways to prevent infection. Proper hygiene practices, like frequent hand washing and using gloves when necessary, are fundamental to infection control. All of these elements tie together in our overall goal, infection control, By following these protocols diligently, we protect ourselves, our clients, and everyone around us. Remember, consistent adherence to these practices is the backbone of a safe and professional environment. Let's talk about daily stretching routines, which are essential for maintaining flexibility and preventing injuries. Incorporating regular stretching into your day helps keep your muscles supple and ready for action. Another key point is scheduling breaks between sessions. Taking short, intentional breaks allows your body to recover, reduces fatigue, and keeps your performance at its best. Rest is just as important as activity. Ensuring you get adequate rest helps your muscles recover and your mind stays sharp, supporting overall well-being. We also focus on core and grip conditioning, which are vital for strength and stability. A strong core improves posture and reduces strain, while grip strength is crucial for many physical activities and injury prevention. Speaking of strength, building it through targeted exercises complements your flexibility and conditioning efforts, creating a balanced approach to health and performance. Lastly, don't forget about therapist self-care. As professionals, taking care of ourselves is crucial so we can provide the best support to others. Prioritizing our own well-being ensures sustainability and effectiveness in our work. All these elements, stretching, breaks, rest, conditioning, strength, and self-care, are interconnected pieces of a comprehensive approach to maintaining a healthy, resilient body and mind. Let's talk about emergency exit protocols. It's crucial that everyone knows the proper procedures to follow in case of an emergency. Clear, accessible exit routes can make all the difference in ensuring safety. Next, we need to focus on trip hazard removal. Keeping walkways free of clutter and hazards helps prevent accidents before they happen. Another important aspect is ergonomic table height. Adjusting workstations to the right height reduces strain and promotes comfort, which is essential for both safety and productivity. Ultimately, all these measures work together to create a secure environment for everyone. Remember, workplace safety isn't just about compliance. It's about caring for each other and making sure everyone can work comfortably and safely. By implementing these protocols and best practices, we reinforce our commitment to a safe and healthy workplace for all. Let's talk about reporting protocols, which are a crucial part of effective risk management. When an incident occurs, it's important to follow a clear process to report it promptly. This includes notifying the relevant medical network or team to ensure immediate response and support. Referrals also play a key role here. Directing cases to the appropriate specialists or resources helps manage risks efficiently. Liability coverage and insurance are essential safeguards. They protect both the organization and the individuals involved by covering potential liabilities. Identifying risks early is fundamental to preventing issues before they escalate. That's why screening processes are so important. They help us catch potential problems at an early stage. All of these elements come together under the umbrella of risk management, which aims to minimize harm and improve safety. By establishing solid reporting protocols, we're not just reacting to problems, we're proactively managing risks to create a safer environment for everyone involved. This integrated approach ultimately supports the overall goal of delivering quality care while safeguarding our organization. Today, I want to emphasize the importance of ensuring that clients truly understand and agree to all the techniques we plan to use. Consent is not just a formality. It's about making sure clients are fully informed and comfortable with the process. Next, let's talk about avoiding dual relationships and maintaining professional distance. It's crucial to keep clear boundaries to protect both the client's well-being and our own professional integrity. Boundaries help us create a safe, respectful environment where clients can trust that our focus remains on their best interests. Finally, all of these points tie into the broader ethical considerations we must keep in mind. Upholding these standards isn't just about rules, it's about fostering trust, safety, and effective treatment. Remember, maintaining transparency and professionalism is key to ethical practice and successful client relationships. Now, let's talk about protecting client privacy and ensuring compliance with HIPAA. Confidentiality is at the core of everything we do. It's essential that we handle all client information with the utmost care and discretion. This means safeguarding sensitive data from unauthorized access or disclosure. HIPAA provides the legal framework for how we must protect health information, and compliance isn't just about avoiding penalties, it's about building trust. When we prioritize confidentiality, we're demonstrating our commitment to our clients' privacy and their well-being. This aligns with our overall goal of providing ethical, secure, and trustworthy care. So always be mindful of how you handle and share information, and remember that protecting confidentiality is a fundamental part of our responsibilities. Let's talk about the right to stop. This is all about client autonomy, meaning you have the power to pause or halt any procedure at any time if you're uncomfortable. Now, when we consider the benefits, we're referring to the expected outcomes, what positive results we hope to achieve through this process. It's important to keep these in mind as they guide our approach. But we also need to be aware of the risks, which are the potential side effects or any adverse effects that could happen. Being informed about these helps us make better decisions together. Next, we have the procedure itself, what exactly will happen during the process. Understanding this helps you feel more confident and prepared. And of course, all of this ties back to informed consent, making sure you have all the information you need to agree knowingly and voluntarily. Overall, these elements emphasize the importance of respecting your choices and ensuring transparency throughout the care process. Let's talk about providing inclusive care for our diverse populations, and a key part of that is cultural sensitivity. When we refer to cultural sensitivity, we're emphasizing the importance of understanding and respecting the different backgrounds, beliefs, and values that our patients bring with them. It's about recognizing that each person's cultural identity can influence how they perceive health, illness, and healthcare interactions. By being culturally sensitive, we can build trust and make patients feel valued and understood. This not only improves communication, but also leads to better health outcomes. It's essential to approach every patient with an open mind, avoiding assumptions, and being willing to learn about their unique perspectives. Remember, providing inclusive care isn't just about checking boxes. It's about genuine respect and understanding. When we incorporate cultural sensitivity into our practice, we reinforce the overall goal of delivering equitable, compassionate care to everyone, regardless of their background. Let's talk about the importance of accurate documentation and secure storage. It's essential that all records are kept accurately to ensure compliance and to support any future review or audits. Remember, maintaining precise records helps us stay transparent and accountable. Additionally, these records need to be stored securely to protect sensitive information from unauthorized access. The standard practice is to keep these records for at least 7 years, which aligns with legal and regulatory requirements. This long-term storage not only safeguards our data, but also ensures we have reliable documentation available when needed. Overall, proper record keeping and secure storage are critical components of good practice, helping us uphold integrity and trust in our operations. Let's talk about specialization today. Focusing on a specific area allows us to deepen our expertise and provide more targeted, effective solutions. It's like becoming a go-to person in a niche, which can really set us apart. Now, moving on to online CEUs. These continuing education units make it easier to stay current and meet professional requirements without the hassle of commuting or fitting in traditional classes. They offer flexibility and convenience, which is crucial in today's busy world. Next, we have workshops. These interactive sessions are fantastic for hands-on learning and networking. They give us the chance to practice new skills in a supportive environment and collaborate with peers, enriching our professional growth. Finally, professional development encompasses all these elements: specialization, online courses, workshops, all aimed at helping us grow professionally. It's about continually improving, adapting, and staying ahead in our field. Together, these components form a comprehensive approach to advancing our careers and ensuring we deliver the best possible service. Now, let's walk through the process of moving from location selection all the way to equipment procurement. First, choosing the right location is crucial because it sets the foundation for how smoothly your practice will operate. You want a space that's accessible, meets your needs, and aligns with your vision. Once that's settled, the next step is selecting the necessary equipment. This involves not just picking the right tools, but also making sure they fit your budget and quality standards. It's all about balancing cost with functionality to support excellent patient care. These steps are vital because they ensure your practice is well prepared and set up for success right from the start. Remember, thorough planning at this stage helps prevent surprises later on and keeps your setup process efficient. Now, let's take a look at the different practice environments for massage therapy. When we talk about spas, medical clinics, and mobile massage models, we're really exploring the range of settings where therapists can operate. Spas are a popular choice. They offer a relaxing atmosphere focused on wellness and pampering. Medical clinics, on the other hand, are more clinical and often involve working alongside healthcare professionals to support rehabilitation or pain management. Mobile massage models are a flexible option, allowing therapists to bring their services directly to clients' homes or workplaces. Understanding these environments is key because each has its own unique requirements, regulations, and client expectations. Recognizing the strengths and challenges of each setting helps us tailor our approach and deliver the best possible care. Plus, it highlights the diverse opportunities within the field, which is really about adapting to different client needs and lifestyles. So, whether you're working in a luxurious spa, a medical facility, or on the go with a mobile setup, each environment plays a vital role in the broader landscape of practice. Let's talk about some effective strategies to reduce no-shows and keep everything running smoothly. First, reminders are crucial. They help clients remember their appointments and reduce last-minute cancellations. Recording updates is also important so everyone stays informed about any changes. On the administrative side, managing your schedule wisely is key, like scheduling 15-minute buffers between clients to allow for overruns or quick breaks, which helps maintain punctuality. Using digital tools can streamline this process, making scheduling and reminders more efficient. Time management overall plays a big role. Being organized and intentional with your time ensures you can handle your appointments smoothly and reduce gaps. All these points connect back to the overall goal, creating a reliable, professional service that clients trust and appreciate. Let's talk about how client testimonials and reviews play a crucial role in building your reputation. Positive feedback from satisfied customers not only boosts credibility, but also attracts new clients. This naturally leads to increased loyalty programs and referrals, which are powerful tools for growth. When clients feel valued and trust your brand, they're more likely to recommend your services to others. Retention is another key aspect. Keeping your clients engaged through social media and local SEO efforts helps maintain visibility and top-of-mind awareness. Regular interaction on social platforms fosters community and trust, making clients more likely to stick around. All of these elements tie back to your overall marketing strategy. By leveraging testimonials, nurturing loyalty, and optimizing your online presence, you create a cohesive approach that enhances your reputation and drives sustained success. Remember, a strong reputation fuels growth, and consistent marketing efforts ensure that your brand remains relevant and trusted in your community. Let's talk about some key massage techniques that can really enhance stimulation and relaxation. First, we have rhythmic tapping for stimulation. This involves gentle, rhythmic tapping movements that can help activate the muscles and nerves, encouraging alertness and circulation. Next is tapotement, which is a series of brisk, tapping motions that can energize the tissue and improve blood flow. Moving on, kneading is used for deep tension release. It involves grasping and squeezing the muscles to help loosen tight areas and improve flexibility. Finally, we have effleurage, which consists of gliding strokes that warm up the muscles and promote relaxation. These techniques are fundamental in massage therapy because they target different layers of tissue, contributing to overall well-being and the effectiveness of the treatment. Remember, combining these methods strategically can really maximize both stimulation and relaxation for your clients. Now let's talk about post-work effleurage, which is a gentle, gliding stroke used after the main work. Its purpose is to flush the tissues, helping to promote circulation and remove metabolic waste. It's also effective for adhesion release, as it gently separates tissue layers that might be stuck together. Next, we incorporate friction, which involves deep, circular movements to break down scar tissue or adhesions that may have formed. As we progress, we gradually deepen the pressure to connect with the body's response and ensure we are working within comfort levels. Superficial prep is essential before moving into deeper work, warming up the tissues to prevent injury. This warming up phase prepares the muscles and fascia for more intense techniques, like deep tissue work. Deep tissue demo is where we apply more focused, intense pressure to reach deeper layers of muscle and fascia. Throughout this process, the key is to balance pressure and technique to achieve effective results without causing unnecessary discomfort. Overall, these steps are interconnected. They build on each other to ensure a thorough and safe massage session, ultimately supporting the body's natural healing process and enhancing overall well-being. Let's take a look at some real-world applications of these concepts, specifically in the areas of chronic pain management and athletic recovery. These case studies really illustrate how the methods we've discussed can make a tangible difference. For example, in chronic pain, personalized approaches can help reduce reliance on medication and improve quality of life. And in athletic recovery, targeted interventions can speed up healing and restore optimal performance. These examples highlight the practical impact and versatility of the strategies we're exploring. They serve as a reminder that, at the end of the day, our goal is to apply science in meaningful ways that truly benefit individuals. Your career in wellness begins here, and I couldn't be more excited to see where this journey takes you. Remember, professional excellence is the foundation of building a successful and fulfilling career in this field. It's about committing to continuous learning, honing your skills, and maintaining the highest standards in everything you do. As you progress, keep in mind that your dedication to excellence not only benefits your clients, but also elevates the entire wellness community. This is the moment to embrace your potential, stay motivated, and lead with integrity. Your path to making a real difference starts now, and I'm confident you'll make a lasting impact.